Welcome to Schmidt Clark Law Firm, steadfast in helping individuals and families since 1992. Today we address a pressing safety issue: the open hernia repair surgery Kugel patch lawsuit. Open hernia repair surgery, a pivotal advancement in medical procedures, was significantly enhanced with the introduction of the Kugel patch. Crafted with precision, this mesh patch emerged as a beacon of hope for hernia patients. Alarming patterns emerged, complications requiring additional surgeries, causing distress and uncertainty for those affected. Astonishingly, these concerns were met with a slow response from the manufacturers, leaving patients and doctors navigating a sea of uncertainties. The side effects of hernia repair surgery can vary, including pain at the site of the surgery, which is a common occurrence and typically managed with pain medication. This pain may range from mild to moderate in intensity and generally lasts from a few days to a few weeks post-operation. Infections can develop at the surgical site, with symptoms such as fever, redness, swelling, and drainage from the incision. If left untreated, an infection can worsen and require further medical intervention. Some bleeding is normal after surgery, but excessive bleeding that causes symptoms like dizziness, lightheadedness, and fainting may necessitate additional treatment. Nausea and vomiting are also possible following the procedure, often due to anesthesia or pain medications, but these symptoms are usually temporary and manageable with medication. Constipation, another common post-surgical issue, may result from pain medications or reduced physical activity. This can typically be alleviated by increasing fluid and fiber intake or through medications. Adhesions or scar tissue around the repaired hernia may form and cause abdominal pain or discomfort, treatable with medication or further surgery. There is also a risk of hernia recurrence, especially if recovery instructions are not properly followed or if the patient engages in activities that strain the repaired area. Additionally, allergic reactions to anesthesia or other medications used during surgery can occur, with symptoms including rash, hives, difficulty breathing, and swelling. According to Reuters, the fourth bellwether trial involving Kugel patch and Becton Dickinson, which is scheduled to take place next month in Rhode Island State Court, features plaintiff Jacob Bryan in the case management conference. In 2018, Bryan filed a hernia mesh lawsuit after suffering complications after receiving a hernia mesh implant. According to this 2017 study by the National Center for Biotechnology and Information, many cases of Kugel hernia mesh recurrence after revision surgery occurred due to mesh retraction or contraction, which exposes the previous defect. Heartbreakingly, some patients faced life-altering conditions such as intestinal fistulas, chronic pain, and infection, which not only degraded their quality of life but also imposed significant emotional and financial burdens on their families. Settlement amounts in these hernia mesh lawsuits, including those involving the Kugel patch, typically range between $65,000 and $80,000, with some reaching as high as $1 million depending on the severity of the injuries and the impact on the plaintiff's life. Recognizing the gravity of the situation, Schmidt & Clark law firms stepped in. With a steadfast commitment to justice, we delved into the heart of these cases, advocating for those impacted by the unexpected complications of the Kugel patch. Our mission is clear: to bring light to the truth and seek justice for those who have suffered. If you or a loved one has been affected by complications from the Kugel patch, don't hesitate to reach out.